Welcome, everyone. Thank you for joining us today. My name is Dr. Louise Ivers. I am the faculty director here at the Harvard Global Health Institute, and it's my pleasure to welcome you to HTHI's Global Health Research and Innovation Speaker Series. This monthly series, hosted by HTHI, is designed to showcase the latest advancements in global health research, with the goal of fostering dialogue and elevating innovative solutions that advance health outcomes worldwide, something we really believe in. We welcome you to continue to join us for more timely discussions every month. I have a few notes before I introduce our speaker. This session is being recorded through Zoom, and the recording will be made available on the HTHI website and our YouTube page in the coming days. We will have time at the end of the presentation to answer your questions. So if you have a question, you may submit it through the Q&A feature on the bottom of your screen, and we'll do our best to get to as many of those questions as we can at the end of the event. So with that, please allow me to introduce our speaker today. I'm delighted to be joined by Professor Aisha Yousafzai. She will be presenting on LEAPS, a two-generation approach for early childhood and youth. Professor Yousafzai's research focuses on promoting the well-being of children and the stability of families among disadvantaged and vulnerable populations in low and middle-income countries, with a special focus on South Asia and East and Southern Africa. She examines both child development and systems as a whole, specifically showing how interventions can promote early childhood development, can be mainstreamed effectively into these existing systems. One of her most significant studies is the Pakistan Early Child Development Scale-Up Trial, a cluster randomized control trial evaluating responsive stimulation and nutrition interventions to strengthen early child development and growth outcomes. She has written extensively about early childhood interventions in low and middle income countries, including recent articles in Annals of the New York Academy of Science, Annual Review of Psychology, The Lancet Global Health and Pediatrics. She serves on a number of advisory groups on early child development for international organizations, including UNICEF and the Early Childhood Development Action Network. We're delighted to have you with us today, Professor Yousafzai. I'd like to pass it over to you to give your talk. Thank you so much.
Thank you. It's a pleasure to be here. I'll just share my slides. All right. So I am delighted to be able to talk about LEAPS with everyone today. And LEAPS is a two-generational program that was intended to unlock opportunities for young children as well as for youth in rural Pakistan. And the motivation for LEAPS really began about a decade ago. I had been working in this part of the country in Pakistan for a number of years, and along with my colleague and close collaborator, Saima Sayal, based at the Aga Khan University, we really were trying to figure out what kind of programs are needed to respond to the context in which we were working, and for Saima specifically, where she grew up and continues to live, so has the real lived experience. And what we identified was really this concurrent host of risks that are across the life course for young children and in early adolescence and as you transition into adulthood. And that was really what began this work. And it would not have been possible without a host of academic partners, including my colleague here at the Harvard Chan School, Professor Sudfeld, Saima Seao and Shalina Bimani at the Aga Khan University, as well as colleagues at the Yale Child Study Center, the Swiss Tropical and Public Health Institute, our funders, Dubai Cares and Grand Challenges Canada, and very importantly, our implementation partners in Pakistan, the National Commission for Human Development. So in this talk, I'll begin by describing the context for young children and youth globally and then specifically in Pakistan. I'll then describe the program, our theory of change, and what we found in our evaluation results. So to begin with, when we're talking about early childhood care and education services, these are really the services provided to groups of children before they ever enter the first grade of primary school. And typically this might include children anywhere from age 3 to about age 6 in most parts of the world. And the purpose of these programs is to be responsive to the care needs, the physical health needs, the emotional needs of young children, their nutritional well-being, as well as their early learning needs, to really prepare them for lifelong learning, for the skills that they'll need as they get older. And we know that when children have access to high-quality ECCE programs, these show persistent benefits to their development, that is their cognitive development, as well as their social emotional development, their future educational attainment in terms of their primary education, and if they move forward, their secondary and higher education, as well as their future adult earning capacity, their physical and mental health, later in life, as well as a reduced participation in criminality. Despite the benefits of these programs, only about 54% of children globally have access to an early childhood care and education program. And we know that there are inequities both between populations and within populations. So just as an example, in some low and middle income countries, access might be less than 20%, and in some high income countries, it sits at about 80%. And yet we know from recent data published last year that the potential benefits are 8 to 19 times greater than the cost of investment of a universal early childhood care and education program when it's implemented in a typical low and middle income country setting. So why is this important? Why is improving equitable access to high quality ECCE programs important? Well, first of all, we know it's associated with good development outcomes for young children. And from global data, we know that on average, in a low and middle income country setting, about 75% of 3 to 5-year-olds are on track for what we would expect for their cognitive and social emotional skills in this age group. And yet the data for Pakistan tends to show that the average is lower than that. It varies across the provinces from about close to 60% in Punjab and as low as 39% in Balochistan. And we know that the low participation in early childhood care and education services is one factor, but it's often coupled with other risk factors. For example, growing up in a disadvantaged setting with poor access to social protection services, to health and nutrition services, and having inadequate resources at home for early stimulation. So it's really an issue of inequity within populations that we're trying to address. And at the same time, we know that as you go along the life course, there are limited opportunities for youth. Globally, the Lancet Commission estimated that there are about 500 million youth worldwide who are either unemployed or underemployed or in insecure jobs. And about 30% of youth, loosely in the age group between 15 to 29 years of age, in low and middle income countries were either not enrolled in education, not in employment, and not involved in training, with greater disparities for youth growing up in rural communities and for female youth. And this is really exemplified in the context of Pakistan, where when you look at primary school completion rates, they're substantially lower for females than for males, standing at 48% versus 69%. There is a higher unemployment rate for females in the formal employment sector, and there is a lower labor force participation rate in general for females compared with males. Despite these challenges, we know that at the time when we were developing and rolling out LEAPS, there were lots of opportunities which we wanted to be able to leverage. A growing momentum in the country for investing in children and youth. And this included growing policy attention to early childhood education, both at the national and at the provincial levels. Particularly in Sindh, we saw that there are great efforts by the Ministry of Education to improve access and to improve quality of early childhood care and education in partnership with academic partners in the country and with agencies such as UNICEF. And also at the time, there was a great national interest in improving the investments for opportunities for young people. And so we really wanted to use that moment, that political moment, that environment, to be able to leverage the type of innovations that we were thinking about for young children and for youth. In addition to the national environment, there were also global opportunities through the United Nations Sustainable Development Goals, where if you look across targets for quality education, decent work and economic growth, as well as gender equality, there were real opportunities to bring together programs that would address these issues for young children as well as for youth, and hopefully amplify the benefits for not just one generation, but for 2 generations. So we thought this was the right opportunity for innovation. And that was really the background for bringing together a program that addressed these needs across young children and youth. And we were really motivated by, for example, peer mentoring that we've often seen in health interventions and in nutrition interventions. But what we wanted to be able to do was understand what that might look like in an educational setting and ensure that we were evaluating benefits not just for one of those partners in a mentoring relationship or in a peer relationship, but for both. So in this case, for young children and for youth. So following much formative work and pilots, we rolled out LEAPS, and LEAPS stands for Youth Leaders for Early Childhood Education, Assuring Children Are Prepared for School. So it's essentially a youth-led early childhood care and education program, and it was designed to respond to the opportunity gaps for young children and for youth. In particular, we were focused on female youth, given the stark inequities in rural Pakistan. And we referred to our youth as community youth leaders. They were between 18 and 24 years of age, and they were trained to deliver quality early childhood care and education services for young children in their villages, in their communities, who did not have access to a preschool program provided by the Ministry of Education in those same villages. So we had two aims. The first was to improve school readiness for young children and ensure that they had an on-time and successful transition from the preschool program into an available primary school program, so that they would be able to successfully transition from one stage to the next stage of the early life course. And then the second aim was to really promote wellness among female community youth leaders, both in terms of their personal and professional development, as well as economic empowerment. Our implementing partner was the National Commission for Human Development, or NCHD, and they've existed since about 2000 and the early 2000s. And they have a shared mission alignment in a commitment to addressing health and education gaps in the hardest to reach areas of the country. So they're there to support ministries of health and to support ministries of education at the local level. And they come under the federal wing of the Ministry of Education. They have years of experience in providing vocational training for youth, but many of these training programs, particularly those that were targeting female youth, were perhaps not really providing adequate skills or economic opportunities. For example, sewing or tailoring courses, which are widespread skills among females in rural settings of Pakistan. And for this program, we partnered with them because they were at the time addressing gaps in primary education. So where the Ministry of Education at the district level was unable to provide a primary school, the NCHD stepped in to provide what is referred to as a feeder primary school. So they either were ensuring that the building was functional, that the salary of a primary school teacher was available. But these schools didn't have preschool programs, and that was where LEAPS came in. So this is the overall theory of change for LEAPS. We begin with the youth, and our goals were to ensure economic empowerment and gender equity at the personal and professional level for female youth. And what we wanted to do was to have recruitment at the local level. So these youth had to be from the same villages where we were intending to implement the LEAPS program. They had to have at least 8 to 10 years of education. They had to be locally nominated by their community members, and which might have included village leaders, and they had to have the support of their family. And this was oftentimes because they would be the first female in their families to be working outside of the home environment. And so they were provided with a 2-week basic training in early childhood care and education, and then up to 2 years of on-the-job coaching and training whilst they were implementing the ECCE program. And so they were then supporting the preschool in their village, and the preschools were designed for children between 3 to 5.5 years of age. And the classes were run for 3 hours a day, 6 days a week, in alignment with the NCHD's primary school program. And the space was donated by the community, and they would be quite varied. So some might have been an unused primary school classroom, others might have been someone donating space in their home, or another might be a shared community space. And the goal was to, through the youth, to support young children's on-track development and their early literacy and numeracy skills. And when ready, it was the expectation that these children would then graduate into the NCHD's feeder primary schools on time, and that they would have the potential to do well in those primary school settings. And to support that, we introduced transition workshops for primary educators to understand the skills that their young children were coming in, and to be able to have a welcoming environment to support a successful transition. So, following a successful pilot in about 10 villages, we transitioned LEAPS across 99 villages in 4 districts in rural Sindh. And every single village had to have a feeder primary school run by our implementation partner, NCHD. So in other words, these were the hardest to reach villages because the Ministry of Education was unable to function there. So it needed partners to step in and support. The first aim was to evaluate the impact of this large-scale implementation of LEAPS on young children and on female youth. And we also wanted to be able to evaluate things like the fidelity, the quality, and the cost of this program. Our study design employed a cluster randomized step wedge design. And that's shown on the figure. Essentially, this is to say that everyone eventually received the program, but we rolled it out in 3 steps. So first, no village had a LEAPS program, and then 33 villages rolled out to have the LEAPS program in step 1, a further 33 in step 2, and finally, the final 33 joined them in step 3. And we evaluated this on children and youth through a child population survey in every single village at each round. So at baseline, and then at step 1, step 2, and end line, or step 3. And then for the youth participants. So we tried our best to get comparison youth, recognizing that the youth that we hired may have been atypical because they may have had a bit more education and a bit more family support than comparison youth we could identify in the same villages. So for children, we measured their school readiness. This includes literacy and numeracy skills, social emotional development, which is critical for successful functioning in life, and motor skills, as well as executive functions. Executive functions are things like your working memory, your ability to retain more than one rule in your head and to be able to use it correctly. And to be able to regulate your emotions, skills that are essential, in other words, for us to do well, to solve problems, to form relationships, to build cooperation, and to navigate our lives both at school and eventually in the life course in workspaces. And for the female youth, we wanted to assess the LEAPS program on their personal and professional development, including things like self-confidence, efficacy, autonomy, their social connectedness and their mental health, their executive functions, as well as depressive symptoms. So what did we learn as a result of the LEAPS evaluation? So this figure just shows the rollout of the step wedge design, and I simply want to draw your attention to round 2, which was the period where, as we were rolling out the final step, there was a lot of disruption to the running of the preschools and our evaluations because of the pandemic. And that's something that we did look at in our analysis. So there was lots of lockdowns, and we had to establish an emergency plan, both to support the young children, but also to support our youth community. And it's important to note that we couldn't really be reliant on technology in contexts where internet access was unreliable, and in the case of the female youth, they may not have had access to at least their own phone in this part of the country. So this shows the description at baseline of our population of each set of clusters for each step of the step wedge design. But overall, you can see that this is a disadvantaged or impoverished community where most of the primary caregivers for the young children, the mothers, had no formal schooling. Many of those primary caregivers, the mothers, identified as housewives, but this often masks the unrecognized or undervalued contribution they make through agriculture to their family's income. And many of these households experience some level of food insecurity. In terms of the coverage of LEAPS, as we progress through round 1 and round 2 of the step wedge design, about 76% of eligible children enrolled in round 1. This dropped in round 2 during the pandemic-related disruptions and then picked up again in the final stages of the step wedge design. So overall, we had about 68% of eligible children in the villages enroll into the LEAPS program. And the counterfactual would have been staying at home. Some children may have gone to a primary school run by the Ministry of Education in another village. And that was often the case if they had an elder brother or sister in that primary school. But it often meant they were in a multi-grade setting. So in other words, they were preschoolers mixing with grade 1, grade 2, and sometimes grade 3 children. And a very small number either attended a religious institution, a madrasa, or a private school, which were few and far between. So what did we learn in terms of the impact for young children? We measured this using the International Development for Early Learning Assessments, which is an open access tool for school readiness developed by Save the Children. And the overall score showed that the overall school readiness for children was significant for those who attended the LEAPS program. And this was the specific case for numeracy, literacy, and social emotional scores, but not for motor development. So in other words, the LEAPS program had an impact on numeracy, literacy, and social emotional development. And when we looked at children's executive functioning and the different tasks that were implemented, the one skill that we saw the LEAPS program participation impacted or benefited was through cognitive flexibility measured by the dimensional change card sort, which is essentially the child's ability to hold and implement more than one rule during a game or an activity. And what this figure shows is an illustration of children in communities with a LEAPS preschool over those different steps of rollout are shown in the blue line. And they had consistently better performance on school readiness tests compared with children in programs, in communities without the LEAPS program, shown in the orange line. But you do see a dip in that round where there was the COVID shutdowns. So how did the LEAPS program compare to other early childhood care and education programs implemented around the world? In general, whether we see formal or non-formal community-based preschool programs in the majority world, these programs tend to benefit children's cognitive and psychosocial development. consistently. Formal programs that are part of the Ministry of Education, part of the primary education system, tend to do better. But LEAPS as a community-based program fared comparably. We're still going through the data for the youth, but this is a snapshot of the qualitative data where we have themes of youth benefiting in terms of their learning and skills development, their emotional regulation, their sense of peer networks, their confidence, their aspirations for the future, support for their own children, and support for their families, financial benefits, as well as their sense of value within the community. So, for example, one youth says, in the start, I used to be angry a lot, but since I joined the school, I learned how to control my anger. Another youth said, before we didn't have the confidence to share our opinion, but after this program, we have more confidence to share our opinions. So LEAPS had small to medium benefits for children's school readiness. While it didn't benefit gross motor skills or the broader scope of executive functioning skills, I think there is more that we can learn as we follow these children, hopefully, in the future. And the qualitative data for youth showed benefits to personal and professional development. But we know that we still want to learn more as we unpack our quantitative data for youth. So LEAPS, as a two-generational program, has the potential to be beneficial for young children and for youth. It shows the usefulness of thinking innovatively about how we can leverage these opportunities, especially in resource-constrained settings, which need innovation if we're to expand opportunities for young people and for young children in an equitable way. And I just want to acknowledge the large team that was involved in rolling LEAPS out. And we hope to be able to continue to learn from this model, but believe that it has applications for similar settings with high child and youth populations. I'll stop there, but I'm happy to take any questions.
Wow, thank you so much. That was a really fantastic presentation of a complex topic and a nuanced intervention in such a crisp and clear way. Thank you so much for sharing that. We do have a few questions coming in, and I'll invite the audience to submit more questions. The first question I'm going to ask, I'm actually going to call out the attendee, Dr. Florence Guillaume, who was formerly actually the Minister of Health in Haiti, and I know is a pediatrician. Thanks, Dr. Guillaume, for being here. And she's saying that it's very inspiring that you presented this very pragmatic experience, and wondering what was the biggest challenge that you faced in the intervention and designing the intervention. And maybe I'll add for a question of mine onto that. What do you think the challenges will be to taking up programs like this and expanding? Because you mentioned only about 54% of children around the world have access to programs like this. So challenges for implementing, designing, and then also maybe for scaling up our policy.
Thank you. So I think there are many, many challenges that we encountered. And I think the first one is really thinking about what do we want to see for youth programs in terms of, I feel that a lot of things that we often evaluate through, for example, cross-age mentoring work in health and nutrition, often we look at the benefits in terms of, does this program benefit the knowledge for the junior partner in that partnership? But we don't look at, does it benefit the mentor? In this case, the equivalent would be the youth. And if it does, how can we really capitalize on that to say that there is a pathway for youth to therefore not just be at the same level, but graduate into other opportunities, for example, education, for example, other employment opportunities. So the challenge that we had during the later stage of this program, and what we continue to grapple with the NCHD and with the Ministry of Education in Sindh, is, for example, for youth that have completed this training program, would they have credit that would allow them, for example, to access a teacher training college because they've done this vocational training program? So I think things like that will be really the questions that we grapple with, is what's next once you've participated in a youth training program.
Yeah, thank you for that. One of the really exciting things to hear about was how you thought about this as a dual program right from the beginning and had the plans to measure the impact on the youth leaders. And I'm curious, and one of the audience is asking the question too about what other types of metrics are you using to evaluate the impact on the youth. And I'm also wondering about how we can think too about maybe the bigger societal benefits of engaging youth and engaging women, especially those, as you mentioned, who are not always used to working outside the home, etc. Can you say a little bit more about that aspect of the evaluation?
Yeah, so in terms of the quantitative measures, which we're still going through, one is mental health, because we wanted to look at change in depressive symptoms and stress experienced by youth, and whether participating in such a program really changes that, because you're surrounded by support, a peer group, and so on. And the other major outcome that we wanted to look at was a sense of autonomy, particularly because we were looking at this as potentially a gender responsive intervention. What I will say as a caveat here is that we found it really challenging to find the perfect measure of autonomy. So all measures need adaptation as you work from one culture and one setting to another. And you need to know that these measures are valid and reliable. But often the majority of measures that we work with start in the US, for example, or in a Western setting, which is, I guess, more individualistic cultures. So when we think about autonomy in a collective society, we need to really be more thoughtful about how we're measuring autonomy. And I think that's where a lot of some of our insights were also coming from, the qualitative findings as well. And so, some of the sort of examples that were shared was things that I would describe as, probably using the wrong word, but spillover effects, for example, because these were often the first women in their households to work outside of the home. That also benefited younger female siblings or cousins or others in the community who saw, actually, this is a positive thing. But we also want to be able to explore, which we can't do very well in the short term, how that changes dynamics, because many of our youth were married or had one child already. So does it change, for example, things like birth spacing? Does it change the dynamics between the couple? So these are things that I hope to be able to track in the future.
That's really wonderful. I noticed, well, as you explained to us the context for the program and the research, I was thinking in my mind of the many stakeholders, and you didn't call them stakeholders, but you were looking at the opportunities of the national interest in the topic, but also you did have many different stakeholders, and of course the community too are stakeholders. And I often get questions from early career scientists or students who are interested in the global issues and wondering about how to start. Like, how do you build that trust? How do you have the trust about the intervention? Could you speak a little more to the process through which, you and your collaborators came to be able to undertake this quite large study with communities and in communities?
So the first thing I would say is that the two things that helped us to get to where we were with LEAPS was, first of all, a long-term partnership. So in the beginning, I introduced my colleague, Saima Sayal, and she and I have worked together since 2008, which is an incredibly long time. But importantly, she is somebody who grew up in one of the districts that we were working in and still lives there. So her insights are just tremendously important. The second is that we worked in small stages. So the early projects we did helped us to really engage with communities, helped us to build the trust with the community, and helped us to establish a team of local, largely local women. So I would say 95% of our team were women. And when I say small projects, it could be a small qualitative study, some initial surveys, but always taking a very community engaged approach, which allows you to build that trust. So for example, I work in the fields of early child development. We know that there are lots of risk factors, including things like gender-based violence, but that is not something that I would have started out working and asking questions about in the community, just because the trust wouldn't have been there in the start. So I think for students and for junior investigators starting out, I would think about building your experience in one or two settings that you feel comfortable in and that you're passionate about, and maybe identifying partners through mentors or through working with local community organizations, but really starting out with those smaller studies to help you really build those relationships, to plant the seeds of those relationships.
Wonderful, thanks. We're almost out of time, but I want to squeeze in one more question, which is coming from a participant in Rwanda who's working on early childhood care and education, and wondering if your intervention, if you've thought about adapting your intervention for families with children with disabilities.
So I didn't go into detail, but one of the things that we did in the program was to say that the program was inclusive, so that children with impairments or disabilities were welcome in the classroom. In some situations, that meant that a family member, like an elder sibling, might have joined them. But we really haven't unpacked that to learn a little bit more about it. What I would say is that as someone who's worked in global work for a long time, I'm not particularly prescriptive about how people take a program, and I feel like the program will always need adapting to the culture, but also to the context. So for example, a colleague of mine is now leading a two-generational approach, learning from Pakistan for Colombia. Now, it's going to be based in a summer school setting. It's very much part of the Ministry of Education in Colombia, so it's responding to the context and the need. It's not focused only on female youth. So I think we're trying to figure out what are the essential ingredients that you mustn't lose, but how can you ensure that the program is still responsive to a new setting? And I think the same would apply when you're thinking about inclusive education programs.
Great, thank you. We've come to the end of our time, so I just want to offer you a chance for any last closing comments or thoughts before we say goodbye to our audience.
So I'm always happy to people to reach out to me, but you can also learn a little more about the program from a podcast that my colleague Saima and I did, particularly if you want the kind of from the ground view that Saima had over the years of the implementation, and that's available through the Lancet Child and Adolescent podcast series. But I'm also very happy for people to reach out to me.
Well, thank you. That's wonderful. And we'll make sure that we link to that podcast in our when we post our recording so that folks can take a listen. This has been really fantastic talk. Thank you for sharing your work with us. Thanks to our audience for joining us. Please save the date for May 13th, which is our next research and innovation session.